Solution Spotlight is going to be giving us a better sense of where that data comes from and the range of ways that we can use it to predict and prevent disease. Jim Golden is the Chief Data Officer for the Rockefeller Foundation and a data scientist and entrepreneur focusing on applying emerging computational approaches to difficult business and societal problems. Ladies and gentlemen, please welcome to the stage Jim to introduce a solution that he calls Data Philanthropy for Climate Preparedness. Welcome.
Thank you very much. Let me see if I can go to the slide clicker. Oh, no, we got to go back a few. There we go. We'll start there. Brilliant. Thank you. My name is Jim Golden. I was most recently at the Rockefeller, where I spent a year on sabbatical. Prior to that, I ran AI for a large quantitative hedge fund. And then I spent a year at the Rockefeller helping them think about a global early warning system. Why that's relevant to our time today is I really think a great deal about data, where data is, where data lives, and what possibly I might be able to do with it. I think why that is important for us is because the message, and we heard a lot from previous speakers today, there is an exceptional amount of data available to us. But most of it doesn't live within the public health sector. It lives elsewhere. And what I really want to think about today with you and work with you on is how we actually create partnerships where data from the private sector can work very closely with the public sector on solving some of these very large challenges. I'm a mathematician by training, so I think very much about mathematics and engineering. I am not a public health person, but I'm very attracted to these very large, very interesting problems. So I take a very reductionist view to things. But when I was putting my slides together, I talked to Kelly quite a bit about what we wanted to talk about. And I thought, very briefly touching on the pandemic we've all just lived through, there are a few lessons learned that I think that are very important for us, especially as we think about what might happen for the next set of pandemics. But the first is that there were a lot of unfortunate lessons learned, including that global health systems and economies are exceedingly fragile in an interconnected world. The extraordinary progress that we have made, both physical, social, and economic well-being of humans over the last half-century has been stress-tested in this time of COVID. Had there been an effective global surveillance system and adequate tracking at the start of the pandemic, we might have made a few different decisions, possibly leading to different results. And surprisingly, we are still witnessing the dismantling of current infectious disease programs. And I observed that we really haven't put together a significant coordinated effort towards global biosurveillance and an early warning system that relies on shared data and information from multiple sources, both public and private. And without that global early warning system for prediction, early detection, controlling, and monitoring the next climate-driven pandemic, we risk stumbling again as we did in the recent past and sliding still further backwards in our progress. Despite this complexity, the factors leading to climate shocks and pandemics are largely predictable. I really believe that. For policymakers, prediction lies at the heart of decision-making under uncertainty, and our vision for an ideal global early warning system for pandemic prediction is an open-sourced, globally distributed data science platform that enables a quantitative approach to modeling the emergence and potential pathway of infectious disease. What I want to think about in the next few minutes is really about data, as I said before, where it exists, where we might be able to get our hands on it, and what we might be able to do with it. My colleagues and I are proposing the components of a cross-sector, multimodal, global pandemic early warning system framed around two ideas. The first is data philanthropy, and the second is a modern logistics for data. Much of the data we need to make accurate climate and health predictions comes from both locally sourced ground truth data from communities and organizations, as well as corporate and commercial sources that generate considerable volumes of data from interactions with their manufacturers, their suppliers, and their customers. Data philanthropy is the idea that these commercially generated data sources can be made available to non-competitive institutions through this open source platform to create significant value when combined with data from local, on-the-ground climate and health stakeholders to identify signals that might indicate emerging epidemics and pandemics. Data philanthropy, I believe, enables a true, effective public-private partnership and the creation of new institutions that can serve the global public good. How these data are collected, stored, and distributed in a sovereign and equitable way is what we mean by a new logistics of data. Data and data science tools, including artificial intelligence, must be democratized for participating societies. Once these disparate alternative data are made available, our vision relies on the creation of a global digital collaboration, a global collection of a network of researchers connected through an open source data science platform capable of quantifying, modeling, and ultimately solving any climate and health problem at any scale. Here's a great example. So what I'm showing you here is an animation that shows the actual biomass degradation over a period of about 4 years. Unlike deforestation, which may only use trees as an indicator, this example combines a multitude of different Earth observation technologies, including imagery, LiDAR, radar, and other sources, to provide information on the loss of biomass underneath the canopy, which can provide a better representation of potential habitat loss and loss of biodiversity. In these examples, we can see how over time, the biomass degradation occurs near roads and river systems and begins to spread out from there. These roads can be considered pathways for vectors of transmission, which lead back to larger population centers. This is the type of information that can assist scientists in determining where they should concentrate their efforts, such as establishing monitoring stations or deep sequencing centers to maximize awareness of potential outbreaks and related vaccine effectiveness. So, interesting images from global satellites, but what does it have to do with health? It's actually very easy for us then to overlay the health data, especially malaria, dengue, yellow fever, Zika. So an effective early warning system will need to integrate data from multiple sources, including biology, climate and environment, biodiversity, social dynamics, infrastructure, and public health. One of the things that we've been looking for is illegal mining activity, which is quite easy to see from space. And this is a significant source of environmental impact. It is associated with a rise in those infectious diseases I previously named, malaria, dengue, yellow fever, other arboviruses. But by monitoring geospatial and other sources of data, combining these with the public health data, and targeted genomic sequencing, we can create a better understanding of the links between climate and health and create responses to mitigate those risks. In contrast with current scientific research-focused systems, we emphasize the need for bringing data together from many different sources, developing a platform for community-driven data modeling, the creation of a modern logistics for publicly and privately sourced data, and the democratization of AI tools for researchers and decision makers across the globe. So again, what we're proposing is a global early warning system. As we can see from the previous example, a well-designed system leveraging many sources of data is needed to predict, manage, and prevent the future impact of climate-related health risks and their concomitant societal fallouts, especially for the under-resourced and at-risk population. What's very good for us, the good news from some of the conversations we're having today, that there are lots of dramatic improvements in computational technology, access to a growing number of digital resources, and increasingly sophisticated AI and machine learning algorithms that have catalyzed significant breakthroughs in quantitative research over the last 30 years. For climate-related biosurveillance, AI and machine learning are of significant importance and utility. The potential of AI to support climate and global public health is driven by three very interesting trends. The first is the emergence of large, complex data sets spanning hundreds of thousands to billions of human interactions within society and with climate and environment. Spatial data specifically is of high value and is expanding at an exponential level. Affordable access to computing, such as the cloud, advanced graphical processing chips, and new statistical techniques, such as deep learning and generative AI, and the growth of global talent pools with the skills to apply novel techniques to large data sets, and the ability to translate results into concrete actions for policymakers. During the coffee break, I was having a conversation with a colleague. If you follow the advances in artificial intelligence, you'll know that ChatGPT-4 is being released this week. You may have seen articles in the public media about how it is able to actually read large volumes of text data and then create essays, answer questions, write papers, etc. It would be very straightforward to link the open source ChatGPT algorithms with all of this available public health data as well as the geospatial data. Can you imagine, which is actually a possibility, by COP28 being able to have a system demonstrated where we can say, please show me all the illegal mining activity in Brazil where there is an uptick in an arbovirus, and it's on a river system. It will be able to show you that. Again, my goal here is not to say that AI is the end-all solution for everything we're trying to tackle, but it will tell us where to look. These data will tell us where we can generate hypotheses for where to go more closely monitor and understand what the risks we are facing. So we've been thinking a lot about how we build something called a global risk index. For me, as a quant and a mathematician, I hear us talking a lot about sustainability. For me, sustainability is not a measurable thing. For me, I think about risk. So I like to think of risk and sustainability as two sides of the same coin. And we have an exceptional amount of data and computational ability for thinking about risk. So when we combine consistent, verifiable, and quantifiable frameworks of measurable indices across a range of impact areas, we could provide needed transparency for environmental sensitive sites that have the potential to influence climate and health outcomes. In order to achieve scale and be temporally relevant, the adoption of technologies such as AI, high-performance computing, Earth observation will be foundational for us to create an impactful global platform. And to develop an effective platform for global risk, we propose the idea of a global community model patterned after other successful public-private partnerships, specifically in climate change research, quantitative investment, and large-scale cancer research challenges. The core distinction from current non-community-driven approaches is that many globally distributed teams from diverse organizations will each develop data science applications for specific use cases, compared to centralized teams developing much more general closed models. So, for example, rather than building a single large model that predicts global weather-related conditions linked to disease transmission, we might say we can use a distributed set of teams to create smaller models that predict endpoints like temperature in Brazil, chance of rainfall in Abu Dhabi, humidity in Hong Kong. These smaller models are inherently more transparent, can be developed more quickly from targeted data sources, and can be more easily integrated to local response. To predict more complex and interactive phenomena, modeling teams can layer small models together to form larger constellations of linked algorithms, which can be automated using machine learning. The results of this public-private partnership will allow local organizations to influence the ultimate rating or index metrics for a particular location in a more robust, transparent, and impactful way. So let me just conclude with a few ideas and calls to action. Because climate crisis and evolving pandemics cross borders and affect all sectors of the global ecosystem, the essential need is for a cross-national and cross-sectoral collaboration. The COVID-19 pandemic laid the foundation for unprecedented global scientific collaboration, which can now be further supported and accelerated. Expansion of these efforts by establishing an open-sourced digital platform that integrates data and signals from multiple sources for all emerging infectious diseases is necessary for us to combat those emerging pathogens. In this way, a multifaceted global early warning system provides the quintessential example of global partnerships as envisioned by the Sustainability Development Goals UN framers, and thus becomes an important linchpin in the larger sustainable development agenda and security in our modern world. I want to emphasize also that these systems can be leveraged to create innovative financial markets, instruments for precise carbon credits, biodiversity indices, and actual quantitative, rigorous ESG metrics. Given the imminent danger of yet another pandemic with unforeseen global consequence, establishing a global pandemic early warning system now takes on a renewed level of urgency. Without a tangible means for prediction, early detection, and continuous monitoring of the next global pandemic, we risk stumbling again as we did in the recent past. Preparing ourselves for the next pandemic presents a fundamental and convergent research to action challenge that will need to embrace a much wider set of solution perspectives, joining together state-of-the-art public health system technologies, more responsive institutional and government systems, responsible private economies, social and environmental justice, and an appropriately trained next-generation workforce. This is something I am very excited about working on with you. I want to emphasize again that there is an infinite amount of data available. Some of my colleagues with me here in the audience have up to 25 petabytes of satellite data we would like to make available to you. We have 5 petabytes of genomic pathogen sequencing data we would like to make available to you. But again, my emphasis is on how do we work together to create new institutions and organizations where we take data from the public sector and the private sector to actually create large, shareable, open-sourced model libraries for us to actually tackle these very difficult set of problems. And with that, I thank you for your time and attention.